Hi, so in this module, we are going to talk about the soil-transmitted helminthic infections, which are a real threat to the public health system in India. They are real and practical public health problems that our country faces. In this module, we are going to talk about the most common soil-transmitted helminthic infections, that is Escherichiasis. We will also talk about Escherichiasis. We will also talk about a hookworm disease. We will talk about the Necator americanus. And we will also talk about Ankylostoma duodenale. We will also talk a little bit about a few words about the whipworm disease, which you need to remember for your exam. So let's talk about the first and the most important or the most common type of soil-transmitted helminthic infections in India, that is Escherichiasis. Before I start, as we have taken in all the previous modules in communicable disease, we had talked about these 60 features. What are the 60? S stands for the source or the reservoir. Then we will talk about the I, incubation period. C would stand for the communicability factors or the modes of transmission and period of communicability, things like this. And S would stand for the special important points which you need to remember for your exam. I would, of course, be the most important thing, that is the immunity, the prevention and the control aspect of that particular disease. So now let us start with Escherichiasis lumbricoides. First topic we are going to talk is about the source factors or the S thing. The reservoir of the infection is a human and the source is a soil. Source is a soil. First MCQ, which soil? Soil which contains infective form of the egg. Infective form of the egg. If you talk a little bit more into this, if you go into the life cycle of the Escherichiasis lumbricoides, there are a couple of MCQs, 5-6 MCQs we need to discuss. When the soil contains the egg, it needs how much time to become infective or the eggs to embryonate. The infective time for the egg to stay in the soil is for 2 to 3 weeks. So in 2 to 3 weeks, the egg will become infective. So that is your MCQ number 2. MCQ number 3. The eggs will enter into intestines. Normal thing, common sense. So it is ingested. They are entering into intestines. In the intestines, they will multiply where? In the villi. In the villi, the eggs are going to hatch and the larva formation is there. So they are going to stay in the villi and they are going to be staying, and the larva hatches in the intestine. Once the larva hatches in the intestine, the larva form will go into the liver. From the liver, it goes into the lung. Now in lungs, it slightly matures. I'm not saying that the adult form will form, but larva will molt twice in the lungs. During this process, it may cause some clinical features. MCQ number 3. The clinical features it may cause is something called as larva migrans. So larva migrans means there are typical clinical features like you will have asthma-like features, eosinophilia and so on. Other pulmonary features would develop. Once the larva molts twice, it slightly becomes bigger. It is again cuffed up. It is cuffed up and again re-swallowed. So now it is going to re-enter the intestine. So point to be noted is that the worm in the life cycle enters into intestine twice. Once during the egg form and just to hatch into the larva, and then the larval stage would enter intestine to mature. So there are 2 times the development takes place, from egg to larva and from larval to the mature form in the intestine. And the mature form would of course be, we will have a male Escherichiasis and a female Escherichiasis. The female is going to lay eggs again. Couple of more features over here. Question number 4. The point from the egg back to the egg stage. So from the egg going to the intestine, to the liver, to the lung, and again cough up, again mature, and back to the egg form, it takes 60 to 80 days cycle. So this is 2.5 month cycle, 60 to 80 days. And that is from the egg to the back to the egg form. Next MCQ. You should also know that there is a male larva and there is a male Escherichiasis and a female. The male is having the length of 15 to 30 centimeters. So that's pretty long. And the female is 25 or 20 to 35 centimeters. The female would lay eggs, right? Female is going to lay eggs. How many eggs? 2 to 3.5 lakh eggs per day. So that's a massive number of eggs that the female is going to lay. 2 lakh to 3.5 lakh eggs per day. So that is your point number 5. Point number 6. We already talked in the previous life cycle, in the life cycle of Escherichiasis, that the eggs will be there in the soil. Couple of questions on this soil aspect. What type of soil can be affected, or what is the climatic or the environmental conditions? Please remember that the soil is pretty different from the hookworm disease. In this, the soil in which the Escherichiasis would be staying is a hard, clayey soil. It should be a hard, clayey soil in which the embryonation of the egg will happen. Also, if you talk about the temperature of the soil, please remember that optimum temperature is anything more than 20 degrees Celsius. If the temperature is below 16 degrees Celsius, if the temperature is below, it inhibits 16 degrees Celsius, it inhibits the embryonisation of the egg. So these are couple of MCQs you get on the source factors or on the agent factors. Coming to the next point about the CICSI, right? Incubation period. The incubation period for Escherichiasis is ranging from 18 days to couple of weeks. If you talk about the communicability factors, the infective material, we already talked on this, is an infective form of the egg. So I'm repeating here again that the infective material is infective form of egg. The infective form requires 2 to 3 weeks. This is very important. But why I'm repeating it 2-3 times? Because it has been asked in exam so many times, because this is one point which is different from the life cycle of the hookworm disease. In hookworm disease, I will be very shortly telling you that the infective form is not the egg, it is the larva. So anyways, right now, just stay focused on the infective form of egg is the main source, infective material for communicability of this Escherichiasis. Till when is the person communicable? The person is infective. The person who harbors the infection is infection till all fertile female worms are present. So the person will be infective till all these female fertile worms are present. Special features. One of the special feature of this Escherichiasis you need to remember is about the clay soil. We already talked on this. You should also remember that when do we call Escherichiasis as a public health problem in the system? We call this as a public health problem if there is heavy contamination of the soil. When do you say heavy contamination of the soil or the feces? We say if the egg is more than 50,000 eggs per gram of stool. If the egg is more than 50,000 per gram of stool, that time we say that Escherichiasis is a public health problem, major public health problem in the area when the feces contain this many number of eggs. Last, coming to the immunity or the prevention control aspects, this we are going to do together with all the hookworm diseases. So talking about the hookworm disease or the ankylostoma, we have two types, ankylostoma duodenale and the Necator americanus. The source features or the reservoir. The reservoir of this infection is again a human, and the source is a soil. Source is a soil. So they are not same, right? So reservoir is different from the source. If you talk a little bit more about the reservoir and the source, if you see the life cycle, that is kind of slightly different from the Escherichiasis life cycle. What is different is that the eggs will be there in the soil, same thing. But the eggs in the soil, they are not directly infective to humans. What happens is, MCQs over here, please remember that what happens is eggs are going to hatch in 1 to 2 days. In 1 to 2 days, they will hatch. Once they hatch, they release, of course, larva. The larva needs 5 to 10 days to attain the infective form. The larva needs 5 to 10 days to attain the infective form. And then we say that after 7 to 10 days, the larva from the egg, which has been coming from the egg, is infective. So what is the infective form in the soil? Please remember that in the soil, the infective form is not the egg, it is the larva. So how much time does it take from the egg to the infective form of larva? We say that usually 7 to 10 days, minimum 5 days. It can take up till 7 to 10 days. Okay. If you get one answer, you're free to mark like 7 to 10 days, but minimum would be 5 days, which is required from the egg point to the infective larva. Once the infective larva is there, it is going to enter into human. There is a primary mode and there is a secondary mode. The primary mode, the main mode is penetration direct into the skin. But there is a secondary mode that the larva may also be ingested through the fecal-oral mechanism. But this is just a secondary mode. The main thing that you need to remember is that they will penetrate into the skin. In the skin, they enter into the lymphatic spread, and there is a lymphatic spread. MCQ over here. Because there is a lymphatic spread, there is something called as a pre-patent period. There is something called as a pre-patent period. What do you mean by pre-patent period? It relates to the pre-patent period. It relates to the incubation period. It is nothing but the incubation period. But what is incubation period? It is from the entry till the first sign and symptoms. Whereas pre-patent period is a time where the organism has entered into the body, and it may lie in a dormant stage, so that infection is not actually replicating. So technically, what is an incubation period? It is from the entry of the organism and till the first sign and symptom, and during this phase, the person may either be infective or there are pathogenesis which is happening in the person. So a couple of things may happen during the incubation period. But in a pre-patent, we technically use this word pre-patent because it relates to the incubation period. The pre-patent period in case of hookworm disease for Necator americanus is kind of a bigger thing, that it may range up till 7 weeks. Whereas for Ankylostoma duodenale, it may range from 5 weeks till 9 months. So for 1 year, ankylostoma may be there in the body and lying in the dormant stage, where in the lymphatics of the body. So that is what you need to remember, that the lymphatic stage may be associated with the pre-patent stage. That is your step number 2. And then once the thing is, the larval form gets activated, it goes into the lungs. In the lungs, it is again molting, and then it is cuffed up. It again goes to the intestine. And in the intestine, you will have mature form. We'll have a male and we'll have a female of the hookworm disease. Right. So coming to some of the MCQs from the agent factors or the type of male and a female, we have a male and the female. The male range is very small. It is 8 to 11 millimeters. The other one was 15-30 centimeter Escheriasis. Whereas in the female, it is of the same size, 10 to 13 millimeters. How many? First MCQ regarding the agent factors. Point number 2 is how many eggs do they release? The eggs released by Necator americanus is something around 5 to 10,000 eggs per day. Whereas the Ankylostoma duodenale, it releases 10 to 30,000 eggs per day. Of course, they are very big in number, but they are smaller than in the number from Escheriasis. You remember in Escheriasis, it was roughly around 2 lakh eggs per day. This one is 10 to 30,000 eggs per day. And in this case, in the hookworm, the worms are little lesser. Why do we call them as hookworm? We call them as hookworm because they have a dorsal curved anterior end. They have a dorsal curved anterior end, and that's the reason we call them as hookworm. So a couple of MCQs from the life cycle. You have heard about the male and female. They become infective. They will release eggs. Eggs will be there in the feces. Feces will be there in the soil. And now in the soil, the eggs will require 5-7 days to become infective. Once they are infective, they go into the skin and the whole thing starts happening. So a couple of points about the environmental factors. Environmental factors, first thing is about the temperature. Next is we will talk about the rainfall and about the soil. Soil also is different. So temperature, it is almost same like Escheriasis. Anything which is less than 13 degrees Celsius and anything which is more than 45 degrees Celsius, it is inhibitory to the larval formation. So the soil temperature they need is optimum temperature. What is optimum temperature? Optimum would be anything which is around 20. It is 24 to 32 degrees Celsius. That is the optimum. Rainfall, anything which is less rainfall is fatal or it is lethal. It inhibits embryonation. So dryness will inhibit embryonation. Rainfall they need is more than 100 centimeter rainfall is promotive to the larval formation from the egg. So the larva or the infection actually fulminates in more rainfall. If you talk about the soil, the best type of soil, it is a soft, porous or a sandy soil. Soft, porous, sandy soil for hookworm, hard soil, clayey soil for Escheriasis. So please remember these small important points about the environmental features. So once we are done with the source factors or the reservoir, the agent factors, let us come to the ICS factors. I stands for the incubation period. The incubation period, we already talked that there is a pre-patent period. Pre-patent period. The pre-patent period for Ankylostoma duodenale, it is ranging from 5 weeks till 9 months. And for Necator americanus, it is anything around 7 weeks, right? You should also know there is an extrinsic incubation period. Extrinsic incubation period, that is 5 to 7 days till 10 days, minimum 5 days. So anything more than 5 days till 7 to 10 days, we have this extrinsic incubation period during which the larva or the eggs will be maturing will convert themselves into the infective form of the larva. Talking about the communicability period, till what time will the person be communicable? Till the time they have all the fertile females, and till the time the stools have the eggs. So the person will be infective till the time the person is harboring the worms in the body. Next is some of the special features. Special features, there are important features which you need to remember for your exam. That is the Chandler's index. What is a Chandler's index? It is pertaining to the hookworm, number of hookworm eggs in the stool. So if it is less than 200 eggs per gram of stool, if it is less than 200 eggs per gram of stool, we say that it is a no public health problem. Of course, it is a problem, but less than 200 eggs per gram of stool, we consider that on a community level, it will not be a very big public health, not a very major public health problem. So then you have 200 to 250, 250 to 300, and more than 300 eggs per gram of stool. More than 300 eggs, or 200, 250, 250, 300 and 300 more. So 200 to 250, this is known as a mild public health problem, moderate public health problem of the Escherichia of the hookworm disease, and more than 300 is what is a severe public health problem. And this has been asked a couple of times, that when do we classify Chandler's index as severe public health problem? When the number of eggs per gram of stool is exceeding more than 300 eggs per gram of stool. You should also remember that hookworm disease is having a special feature that regarding the clinical features, it has special feature that hookworm is most common cause of soil transmitted helminthic infections leading to anemia or chronic blood loss. So in the clinical features, once the larval form is there, it enters into intestine, it multiplies in the intestine villi, and it leads to chronic blood loss. There is chronic blood loss. So talking of the community level, it may lead to more chances or more prevalence of anemia in the community. So one of the reasons of anemia is, of course, soil transmitted helminthic infection. Another point for us to note over here is that sometimes because the larva or the mature form or the adult form is multiplying in the liver, in the intestine, and it is staying in the intestine, it may sometimes lead to loss of the plasma in the intestine. So once there is loss of plasma in the intestinal lumen, this will lead to protein loss and is again a major problem for causing hypoalbuminemia. It may lead to hypoalbuminemia, and it is again a big headache as a public health system, that these are some of the important features that you need to remember for your exam, because this is what makes it as a public health problem. And next is we are going to talk about the IPC, that is immunity prevention and control. If you talk about immunity prevention control, no major things. Only thing for your exam you need to remember, there is a primary prevention. And on this, it might not be major for you. On this, the government of India is spending crores of rupees every year for implementing the primary prevention. What are the primary prevention strategies? That is to improve sanitation, to decrease outdoor defecation, Swachh Bharat Abhiyan. All these things are only to prevent or to promote primary prevention and to prevent defecation in the fields, and promote sanitation, more toilets should be there, all those things. So the primary prevention is promoting sanitation and to provide safe water supply. Safe water supply to the whole public, and that is what is primary prevention. Secondary prevention is what we do in the clinics, that is what is early diagnosis of the cases. and prompt treatment of the cases. So MCQs on what are the treatment modalities. Please remember the drug of choice is albendazole. Albendazole, it is given at the rate of 400 milligrams single tablet, and it is given under the National Health Program. We are giving it as biannual doses also. So biannual doses, single tablet 400 milligram, age is more than 2 years, for age more than 2 years. Other drugs which can be given, we can also give mebendazole. It is given at the rate of 100 milligrams each day, and it is given for 3 days. 100 milligram in 2 divided doses, we give it for 3 days. Other drugs we can also have is levamisole or pyrenterol. Please remember that levamisole is considered as the best drug. It is one of the most efficient drug for control of soil transmitted helminthic infections. It is given at the rate of 2.5 milligram per kg body weight, given till a maximum of 150 milligrams. It is considered as most efficient drug, but under the National Health Program, we cannot give levamisole to the whole community. Under the National Health Program, we are giving only albendazole. A few points over here I would like to make regarding the National Deworming Program. The National Deworming Program is held on. It is not like, it's not something to celebrate it on. It is held on 10th of February every year and 10th of August every year, twice every year. On this year, the whole community in the whole country is being given albendazole as mass drug administration. So people who have the disease, they will be taken care of. People who don't have the disease, they might get prevented. So it may be taken as a mass chemoprophylaxis, or it may be taken as a mass treatment modality, but all said and done, we give albendazole as a mass drug administration. How is it given? It is given to all children age 1 to 2 years at the rate of 200 milligram tablet. We don't have a 200 milligram tablet, we give them half tablet. And age more than 2 years till 19 years at the rate of 400 milligram tablet. This is one tablet we are giving. So it is given to the all public age 1 year till 19 years. All population is going to take this albendazole tablet under the National Deworming Program. So some of the salient points which you need to remember for your exam is regarding Escherichiasis and regarding the hookworm disease. Please remember that Escherichiasis is longer. It ranges from 15 to 30 centimeters. Hookworm is smaller. It ranges from 8 to 13 millimeters, depending on the male or the female. The Escherichiasis releases large amount of eggs of 2 to 3.5 lakh eggs per day, whereas the hookworm will release anything from 5 to 30,000 eggs per day, depending on Necator americanus, which is releasing lesser number of eggs, or Ankylostoma, which releases 10 to 30,000 of eggs. Please remember regarding the soil also, the soil for Escherichiasis is a hard soil. For hookworm, it is a soft or a porous soil. Please also remember that the temperature over here, it is said that 16 degrees Celsius, less than 13 degrees Celsius. Of course, it does not make a major difference, but that's what it is said. Next is, you should also talk about the lifespan. We have to cover this. The lifespan of Escherichiasis is ranging from 1 to 1.5 years. The adult may live. The hookworm may live for 1 to 4 years. Please also remember, from public health point of view, Escherichiasis is the most common soil transmitted helminthic infection, whereas hookworm is the most common soil transmitted helminthic infection associated with anemia. So associated with chronic blood loss, think of hookworm. Associated with just helminthic infection or chronic diarrhea or flatulence kind of thing, we think of Escherichiasis most of the time. Please also remember that Escherichiasis egg are infective. Very important, very frequently asked. Hookworm, eggs are not infective. Eggs are not infective. Eggs are not infective. How much time does the egg will take for hookworm from egg till larva? Larva is infective in hookworm, right? It takes, the extrinsic incubation period is 5 to 10 days, whereas the extrinsic incubation period for egg to be infective egg, that is 2 to 3 weeks. So these are couple of your MCQs which are directly asked in your exam. You cannot afford to forget them. So let's take up the next one. We will talk a little bit about the whipworm disease. It is one of the important soil transmitted helminthic infections in India, and it is the third most common cause of STH in India. The points for you to remember about whipworm disease is that it is one of the soil transmitted helminthic infections which infects and resides in the large intestine, primarily in the cecum. So if you just watch about this life cycle again, so the eggs are there in the soil. The eggs are directly ingested. There is no larval form. So the eggs will be ingested. In how much time the eggs will become infective? Usually it is said that it takes from 14 days till 21 days. If you get one answer, please mark 21 days, as most of the researchers would be saying 21 days. The egg will require from the time of making of the egg or present of the egg till the time they are infective form. So eggs are infective in whipworm also. The eggs are ingested. The eggs will go into small intestine. In the small intestine, they again same thing. They develop in the small intestinal villi and they are going to hatch over there. And once they hatch, the larvas will enter into the large intestine. And in large intestine, they are going to attach and develop over there in the large intestine. Which part of large intestine? Usually it is the cecum part of the large intestine. And then they are going to mature, and then we'll have a male whipworm, and we'll have a female whipworm. Usually, if you talk about the male and the female whipworm, the male or the female, they are ranging from 30 to 40 millimeters in length. If you talk about the eggs, the female is going to lay eggs. They lay egg between 200 to 10,000 eggs per day. So again, that same issue that the whipworm is going to release so many eggs and the eggs will be infective form in the feces. But when? After 21 days. Next important feature that you need to remember about whipworm disease is that whipworm disease may be a leading cause for dysentery, chronic diarrhea, especially in females and young children. Females, this is one of the very common causes. Of course, you also have the most common causes escheriasis, but in case of anemia, it is hookworm. In case of diarrhea and dysentery, it may be associated with the whipworm disease as well. So these are a couple of things you need to remember about the whipworm disease. With that, we close this topic on soil transmitted helminthic infections.